Hello, everyone, and welcome back to another episode of the Uncensored Truth. I'm Peter Reddick, and we are fortunate to have Miss Sarah Wallis returning with us tonight. And
Hello.
we are going to have a very special episode for you guys. Tonight, we're going to be talking on the topic of mental health. Miss Wallis, why don't you do a brief introduction on yourself? Tell people about who you are again.
Sure. So, I am a registered nurse. I've been a registered nurse for almost 10 years. Presently, I work in hospice. I've been a hospice nurse for about 2 years now. Prior to that, I did some time in home health, and back before that, I spent about 7 years working in mental health. So I worked in an inpatient psychiatric hospital, predominantly with children and adolescents. Also spent some time with adults in extended care unit, working with various psychiatric issues in an inpatient setting. I was a case manager during that time, so I spent a lot of time with the psychiatrists, developing plan of cares for the patients. So I have a lot of understanding of treatment of the psychiatric condition.
Awesome. And I know, just a recap of what we talked about last time, we were talking about the COVID condition. And I know we kind of went on some other topics as well. One of the topics you brought up, or one of the examples you brought up, I thought was, hit very much at home, I'm sure it did with a lot of people. And what you were talking about, how, people who are in mental health aren't getting the treatment that they need. They're getting just generic care. Can you you want to talk about that a little bit more, elaborate a little bit on that?
Sure. When I used to do nursing education to nursing students, and when I would go over this with them, it's a very simplified process. So when someone is admitted into an inpatient setting, or even if they go and seek psychiatric care in an outpatient setting, predominantly, especially when there's psychology or psychiatrists involved, predominantly the treatment is a regimen of medication. So in order to prescribe someone with any type of psychiatric medication, they have to have a one of 4 diagnoses. So basically, any mental health condition is limited down to 4 diagnoses. You either have to have major depressive disorder, bipolar disorder, schizophrenia, or schizoaffective disorder. Those are it. That's it. So even though mental health is such a broad spectrum of condition, and it's so individualized as far as the need for treatment and care plan, as far as medications go, you just need one of those diagnoses and you're off to the races as far as treatment. So you may not have bipolar disorder, but you're prescribed to be prescribed medications, you're getting that diagnosis. And this definitely goes in play when you have somebody that has like a borderline personality disorder, any of the personality disorders. But borderline personality disorder, I think, is one of the most predominant personality disorders in the psychiatric field because they're the most self-destructive and difficult to integrate into a society setting. Mm-hmm. So somebody who's like a sociopath can still function. They can highly function in a society setting, so they don't necessarily need to be medicated. But somebody with borderline personality disorder would be someone who would be actively seeking treatment. That person, even though what they have is a personality disorder, which is a manifestation of their environmental situation, like it's the result of their upbringing and the poor childhood, they'll be medicated. But borderline, any personality disorder is not a mood disorder. So then they are diagnosed with depression, or they're diagnosed with bipolar. Quite often they're diagnosed with bipolar disorder. I think bipolar disorder is the most misdiagnosed condition out there, because everyone just gets that slapped onto them so they can be prescribed medication. So it's kind of the reality of the mental health field right now. And I tell people, like, they'll get this diagnosis put on them and they say, oh, I have bipolar disorder, or I'm schizophrenic. They diagnosed me with schizophrenia. And I tell people the diagnosis is only worth its weight in medication, because that's all it's there for. It really doesn't even matter anymore what you're diagnosed with. It's only because everybody's treated with the same medication for the same symptoms,
Right.
sadly. So yeah, the treatment just doesn't, it's no different.
Now, I want to clarify something, and with this question is mental health, is it something that is genetically passed on, or can it be acquired, or is it acquired through, situations of life?
So they say it can be genetically passed on. The long and short of it, and I will try not to get long-winded, Peter. I find this all very fascinating stuff,
Well,
but
same here, yes.
I try not to get long-winded. So they have found, when examining the genes of an individual, that some genes have a certain component that seems to manifest in people that have a higher propensity for anxiety. So in that sense, you can be born with that you're more sensitive. And so that person, if faced with the same trauma as somebody that does not have that component in their genes, they're more likely to have long-term effects because of it. So in that regards, it is hereditary, because your genes are passed down from your parents. They often say that there's a hereditary component to depression or schizophrenia or bipolar disorder. I can say, I mean, they don't really know specifically what causes some of these things, so it's hard to say that they can find a correlation between parent and child. But I can say, even if it's not necessarily hereditary, there is also a pattern in the fact that if you have somebody who's depressed, for example, they are more likely to raise children that are depressed because they're exposed to that level of depression growing up. If you have somebody who's schizophrenic, they're usually, they're going to raise children that have an unstable home environment, so it can cause them to manifest their own level of delusion and hallucination. That doesn't necessarily mean that it's hereditary. I think a lot of times, so somebody who can be raised in a home that has a lot of mental instability, they're more inclined to have that mental instability. So whether or not it's hereditary, it's hard to say. I think a lot of it is environmental, especially with children and adolescents. So schizophrenia and bipolar are the two big mood disorders that they cannot be diagnosed until you're in your mid to late 20s. They often don't, especially schizophrenia, doesn't manifest until you're in your mid to late 20s. So that leaves, as far as children go, that being said, you cannot diagnose an adolescent or a child with schizophrenia or bipolar. Sometimes doctors try to do and get away with it, that they shouldn't, because it's against the DSM code. The DSM is a book that has a very itemized descriptor of each of these diagnoses to say, if somebody's to be diagnosed with this condition, they must have this, and this apply. So anyway, I digress. With children and adolescents, you're already removing schizoaffective disorder, which is basically like schizophrenia and bipolar. They can't have any of those. So every child or adolescent that's medicated has a diagnosis of major depressive disorder, unless it's ADHD or anxiety, which is a different thing. But So all of those children, like these hereditary factors, the things that they say are hereditary, like schizophrenia, aren't manifesting until they're later. So all of these children are in a mental health field because of environmental situations. 99% of the time, if you have an adolescent or a child or even a young adult, someone who's 18, 19, 20, in the mental health field, it's because of environmental factors. It's very rarely hereditary.
So with it being an environmental or learned condition, now, what are your thoughts and opinions? Because mind you, I take mental health very seriously as well. Especially being a vet, I believe, I think it should be taken a lot more serious than it really is. So, but I want to also say this: it seems like the generation we live in today, they have a lot more, let's just say, special needs when it comes to, society and them not getting their ways. And I'm talking about people who are like grown adults who are needing like safe spaces or, needing a coloring book and crayons, in college. Or who are just irate and just hate life in general and want to cancel everything just because they don't like it.
Yeah.
I think the most concurrent one that's going on is Dr. Seuss. But
yeah.
What are your thoughts on the mental health status of society nowadays?
Well, I think that there is in this country a push for recognition in anything that society wants to ostracize as taboo. Homosexuality is a great example of that. So there's a push for normalization of homosexuality. As a result, you go to it ends up tipping the scale in the very far opposite direction. So they've reached and surpassed normalization to now they're getting to the point that they're crossing new thresholds of expectation. With the transgender rights, with pedophile rights, all this crazy new nonsense that just keeps pushing the envelope beyond. Like there's never a sense of satisfaction in that. And I think mental health's the same way, where unfortunately there has been this push for recognition in that whole field. And now it's become to the point that it is so normalized that it's almost odd to not have a mental health condition. And so there is full acceptance of victimization. Unfortunately, our culture is being manifested into this culture of victims and weakness. You're actually, the days of Hemingway are gone. Ernest Hemingway, the writer, he was the alpha male, the man's man, and all of his characters of the generation that he wrote about were manly men, and that whole concept, the Hemingway concept, has become villainized, especially with our young boys, and unfortunately they're at most risk of this culture of turning everything on its head. How they say that we're living in a clown world. It's because nothing is sacred that once was sacred, and everything's become sacred that once was taboo. And mental health is no exception. And so unfortunately, because of that, the people that still cling to normalcy start to not take mental health seriously for different reasons. It used to be something you didn't talk about. People got lobotomized and stuck in a state hospital, and forgotten. But now it's something you don't talk about because everybody is over broadcasting victimhood to the point of eye rolling. And so you don't really believe people have the mental health conditions that they have, or you can't take it seriously anymore.
Right. Now, I know you brought up the ideology of the transgenderism and stuff like that. Now, I mean, I have my thoughts on it, and I'm going to be very careful with my words here. I think that, in my personal aspect on this is, if somebody wants to, who's a guy and born a man and has the DNA of a man, wants to go out and cut off his manhood, they should have their mind. They should have their mental status checked out. But I'm gonna take this a step further. The reason is, you got people like, who's the new Secretary of Health?
He's from our state.
Was it? I'm gonna call
Dr. Levine.
Roger Levine.
Okay. Dr. Levine. Yeah. Dr. Rachel. I don't know her Christian name. I don't know her birth name.
Right. Well, I'll just put it this way: when he's going out and telling people that it's okay for a 5-year-old or someone who's in kindergarten they have the consent, or should have the consent, to go through transition therapy, they've got a couple screws loose themselves, especially when they're trying to abuse and mutilate children.
Yeah. Well, there's studies on transgender that show that a large percentage of men, for example, men who it's usually teenagers that go through this identity crisis, that start to manifest these ideas that perhaps they're the wrong sex. And they did a study to show that if with men, if they don't pursue the change sex, going through change of sex, taking estrogen, and going through the process of transitioning, if they don't pursue that into their adulthood, they are usually happy that they didn't pursue that. Quite often they become homosexual and just live their lives as homosexual men, but they are happier for the fact that they didn't pursue gender reassignment at a younger age. So it is something that I think that so it used to be that they would have to go through 2 years of therapy before going through any type of reassignment. I don't know if that's changed because there's been a normalization of the transgendered condition, so that might have been decreased. But before it was so normalized, before Caitlyn Jenner, they had to go through 2 years of therapy before getting actual surgery. But during the time that they're going through the therapy, they're able to take hormonal treatments, estrogen or testosterone, based on their desire. Now, Dr. Levine, it's interesting that you would bring that doctor up, because we've had run-ins with this doctor in the mental health system, because that doctor, before she was Surgeon General, actually had a private practice where she would work on gender reassignment of teenagers. So we'd have people admitted to inpatient psychiatric care because you cannot want to change your gender and not have a mental health situation. No matter how accepting one can be, you have to understand that it's inevitable that it's a mental health situation, that they need some sort of therapy to make sure that this is the right decision. But in any case, we had a lot of people admitted that were going through transitioning, taking hormonal therapy under the care of Dr. Levine, and they weren't even 18. We had one as young as 12. So I'm not entirely fond of that particular individual because of that. I feel like it can be very damaging at such a young age to make these sorts of decisions. Now, that's my personal opinion. Unfortunately, I'm not in the minority, and as far as social culture is concerned, it's more and more normalized. But I think there's lasting effects when you start to influence someone's hormonal condition prior to them even going through puberty.
I completely agree with that because, okay, I mean, we all went through puberty at one point or another, you know, and, looking at the stats, they want to put out there that, people who are not able to transition, who are gender confused, or, that have a higher suicide or higher in depression, have a higher suicide rate. But in reality, those numbers still are almost equal to people who have transitioned. So, I mean, it's one of those that transition does not help. It doesn't work. I mean, because you're still going to have those same. It's built in your DNA for you to have, of what you are. Whether you want to call yourself a pink purple dotted elephant, you still are what you're born. And that's, like I said, that's my personal opinion on that. So,
and like I said, with this victimization culture, it makes it so that if anyone's experiencing transitioning like this, it's not their fault that they're having these mental health issues. It's because they're not being socially accepted. It's not my fault, it's your fault, that sort of thing. So they don't ever do the work that they need to do on themselves because they're so focused on blaming everyone around them. And so very little is resolved prior to going down this path. That's kind of irreversible and causing physical change. But even with so many other things in mental health, I think there's so little that's resolved. Everyone just wants to bury the issues that they're dealing with instead of working through them, because it's too much effort and too much self-awareness. That's just so much easier to take a pill and go on your acts of daily living without thinking about it and canceling all your future therapy appointments.
Right. Well, let's move on here a little bit. How has COVID affected mental health?
Well, it's being that I'm not in the mental health field anymore, I can't say specifically if there's been any big change in the mental health field with COVID, but I can imagine statistic-wise that there's a lot, there's a lot more isolation. This is a trend that had already been started with our culture, with the internet culture, that so much of our youth and now young adults are so used to not even leaving the home. And so this is only amplified and kind of spread out to the older generations as well. Everyone's just isolating, and it doesn't take long to recondition yourself to get used to that sort of change. So I think even if they would come to us tomorrow and say, okay, the lockdowns are over, everything can go back to the way it was, no masks required, I think it would take almost as long to uncondition yourself as it was to condition yourself to the circumstances that we're in right now. I don't think everyone would just suddenly come outside and breathe the fresh air, unfortunately. So it's hard to do a self-awareness, especially for somebody that doesn't have a lot of practice and understanding with mental health. It's easier to just kind of internalize everything, which is the worst thing you can do when you're feeling depressed, is not talk to someone about it. But I think a lot of people think that, oh, I just feel this way because of COVID and it'll go away when COVID goes away. And so there's no real effort made to change and self-improve. And there's a lot of people just kind of doing the mind-numbing route of, sitting in front of a television and not focusing on themselves at all, or doing anything healthy for themselves. So as a result, I think this is all compounding to cause a huge influx of depression without understanding. There's a lack of faith in this country, which also amplifies the situation, because there's a lack of purpose. Nobody understands, especially men, don't really understand what their purpose is in life. And when you don't understand what your purpose is, you don't really know what you're pursuing, and so you feel trapped, and you deal with a lot of nihilism, which I think is just amplified because everybody's kind of stagnant. So I feel like in the next couple years, if this persists, we're going to see a huge social breakdown, where there isn't going to be a person out there that isn't dealing with some level of depression or anxiety, which is really sad.
Now, how's all this affected your field in hospice?
I think a lot of it is more an issue with the families. The patients, I mean, it's been a year now since a lot of them have seen their loved ones in these nursing homes. They're not allowed to have any visitors, and that's still going on. They might permit window visits, but a lot of times they can't hear through the window. So they'll talk on a phone, like talk to each other on the phone while they're looking at each other through a window. But there's a lack of physical interaction with that. A lot of these people in the nursing homes relied on their families to come in to feed them. Like, the nursing home staff don't really have the manpower to sit and take that type of effort with people. I feel like more people are declining more quickly because they're not getting care from their loved ones. They're just getting care from the paid caregivers that can't give them that extra time and attention. So they're not eating as properly. They're not drinking like they should. They're not out of bed as much as they should be. They're just spending more time sitting in bed all day. And so all these things are just kind of compounding the situation. As far as their mental health, some of them are more lucid than others. I'm dealing with hospice. I mean, my 70-year-old people are young in my field. 80s and 90s is where I'm dealing in. So their mental faculties are usually not there, or at least they're on a decline. So they don't really understand why they're not receiving visitors, or maybe they don't even understand who could possibly visit them. I mean, I have patients asking when their dad's coming to pick them up because they don't even know how old they are. So it's kind of, mental health isn't affecting them quite as readily as it is the families, who are just riddled with guilt. They feel responsible for any type of decline that their loved ones go through, because they can't be there for them. It's frustrating and heartbreaking. And there's so many times that they can't even really see them. The facilities will let the families in when it gets to the point that the death is imminent, but by that point the patient is usually unconscious and will not wake up again. So they don't really have a chance to say goodbye or have meaningful interactions with them before they die. And if those particular patients are actively dying with COVID-19 diagnosis, they're not permitted to see family at all. So those people will actually die without ever seeing their loved ones, which is really heartbreaking. But it's more so for the family. The effect is pretty long lasting and difficult for them.
So
yes.
Let me ask you this. I mean, since this is such a very important topic, and it's not one that is talked about a whole lot in a positive light, if someone does have mental health issues, or someone knows someone with mental health issues, what would your advice be to them?
It's so important so if you notice somebody is having some sort of mental health decline, it's so important to have them talk to someone, whether it's you or somebody else. They just need to have somebody that they can trust, that can advocate for them. It can be very exhausting when it's somebody that it's been a lifelong situation, usually borderline personality disorder is a big one. And I see this a lot with people that have parents that have mental health issues. And so they want to be supportive to their parents because unfortunately, we have coded in our genetic system to love our parents, whether we really want to or not. So they can become a leech on your emotional state if they have mental health issues. And that's unfortunate. And sometimes when you have that sort of situation, you have to have very firm boundaries and be able to say when enough is enough and cut ties so that you don't tax yourself. But when it's just a certain person that you feel is struggling with mental health, they're isolating, they're not talking as much as they used to. One of the big signs is they're not as interested as they used to be in things. So if you had a friend that you used to go on walks with and all of a sudden they stop wanting to go and they cancel all the time, that might be an indication of increased depression, because the more depressed you are, the less you want to do anything, even the stuff you love. And it's important to just have them talk. And it's the hardest thing for a lot of people to do is start talking. But once you open that floodgate, it just all pours out. And whether you help them or not is irrelevant, because a lot of times they can help themselves just by talking. It helps them work through their own problems. And even if they can't work through their own problems, they're able to identify what those problems are. And it is very cathartic to be able to vocalize them to somebody else. So don't think to yourself, well, I know this person is struggling, but I have nothing to offer them. I'm not a therapist. There's nothing I can do. I don't know what advice to give them. I'd rather not discuss it, because it doesn't matter what your advice is. And you can even say to them, I'm just here to listen. I really don't know what to tell you, but I can listen. And that's all you really need to do. But it's very important for the person that's struggling to be able to vocalize what they're struggling about. That's all you really need to offer them is
I completely agree. And I will say this to everyone right now, that if you do know someone, or you yourself are someone who is struggling with depression or suicide or something along those lines, or any mental health disorder, and you need to reach out, please reach out to someone. I mean, that is the most important thing you can do. All right.
Absolutely.
I think we are coming up to the end of the show right now. And I want to say thank you again for coming back and, talking with us about this.
Of course.
If you guys like the content that you guys see here today, I urge you guys to like, comment, and subscribe, and share these videos. We want to get this information out to anyone and everyone there is, especially when it comes to mental health. You want to help, maybe they're having a hard time reaching out, or, being social, but they'll see the video and, it'll help them out, maybe get them to reach out. So yeah, I urge you guys to do that. In the meantime, thank you again for coming on, and I hope to have you on again real soon.
Sure, Peter.
And for everyone else out there, thank you guys for tuning in, and God bless.